All right, what's up? Today, I'm Josh Satterlee. I'm Josh Satterlee every day, but I wanted to cover today with you 5 more evidence-based best practices for healthcare communication. Healthcare communication has to improve. It's not great. And so the research says that patients are unsatisfied. They don't feel like they're being communicated with. And if you look at patient satisfaction scores over the last 20 years, they're going down, down, down as reimbursements are going down and time's going down. So we got to change something. So I want to share 5 best practices that'll help you grow your office, have less no-shows, get better patient compliance or adherence, right? Get better results and work less, make more money. So number 1, use the power of scheduled send. So what is a scheduled send? Scheduled send is when you write a message when you're with the patient or immediately after they leave, and then you schedule a time you want it to go out. Why is that so important? Well, the time delay can build the psychological effect, and turns out that 4 researchers, Yunkin, Williams, Stolwick, and Haynes in 2018 in the journal titled Endocrine found that patients forget most of the information that they're given, and this was done in diabetes patients, hence the Endocrine journal, right? Patients forget important info given at the visit. They especially forget when providers only deliver that information verbally. So what's the solution? They found that sending a message 24 hours later actually improved the baseline amount of information better than immediate recall. What does that mean? When the patients left their visit, they remembered some, but getting that message 24 hours later, they remembered a bunch. So use that delay and schedule your messages to go out. Also, patients who received a reminder had higher retention of what their homework was. That really helped them have autonomy and buy-in of their own healthcare. That's so important. So that's definitely a best practice. All right. Number 2, the research says, don't bullhorn them. What is bullhorning? Bullhorning is when you send a message to a patient that can't be replied to. And unfortunately, this is so common in EMR softwares. They will say, hey, we'll send text messages on your behalf. Kind of. Number 1, they're one-way text messages, which I always say, if you think that works, try that at home with your partner for a week and tell me how it worked out. It doesn't work that great. So people have to be able to respond to those messages. They have to be able to comment, sometimes reschedule. And if your system is only allowing one-way messages that they can't reply to, you're breaking that trust. So we know that Shimoni, Napita, Castano in 2020 in the Medical Research Methodology Journal studied data collection via text messaging. And the key sentence in this research article was, clinicians and researchers should ensure that patients can receive and respond to text messages. They found that text messages work better than almost anything else. The key was, can the patient receive it and respond to it? And unfortunately, most EHR softwares just don't allow for that. So make sure you're not doing that. You're not sending one-way messages that feel like somebody just yelling at you with a bullhorn, okay? So number 3, best practice from the research that we see to improve healthcare communication is patients prefer what's called one-number convenience. And this kind of goes with our last one, right? Not bullhorning them. But what is one-number convenience? A study done by Bowman and Smith in 2010 found that patients had much higher satisfaction if they only had to respond and schedule with a single number. So the number they call for the doctor's office was the same number that they got appointment reminders from, which was the same one that they could text and reschedule with. And that was the same number if they wanted to ask questions. That one-number convenience skyrockets patient satisfaction. In fact, in the study, it improved it from 56% to 70%, independent of how the visit went with that patient. That's incredible. 15% almost growth without having to deliver any better care. And it really improves the patient satisfaction, really tells you what's important, right? Also, in this study, now this is done at a big clinic, but it saved 247 hours of staff time when the patients could connect through that single number. They weren't transferring people over, chasing patients. No. One number, and you just send the messages to the right person at the right time. So shoot for one-number convenience. If your EHR sends out messages on your behalf from a number that's different than your clinic number, you really want to look at that and try and improve on that because it will increase your patient satisfaction. Tip number 4, evidence-based. Here we go. Use the teach-back method. In healthcare communication, the teach-back method is one of the most effective ways to get patients to buy off and become part of their healthcare journey. What is the teach back method? Well, that's where at the end of a visit or even midway, you ask the patient, Mr. Jones, Mrs. Johnson, teach me back what you learned today at the visit. Now, they don't have to say it verbatim, but all you're looking for, are they connecting with the big ideas? For example, in that diabetes study, do they connect with the idea that foot health is and needs to maintain as a priority? If they don't teach that back to you as a provider, it tells you you need to improve your communication. What you think you said and what the patient actually received are very different. So use the teach back method. The other thing that's so positive about the teach back method is that when we use the phraseology of teach me back what you learned instead of tell me what you heard, the patient feels like they take ownership and that they get to teach you, the provider, something that you may not know, which is crazy. It's a crazy psychological shift, but it really promotes that patient autonomy that we always look for. So if you want to promote patient autonomy, use the teach back method. Dean, Bonner, Ramsbotham, and Hines in 2016 did a lit review and found that the teach back method helped patients with increased knowledge of their disease. It significantly improved adherence. It promoted self-efficacy, and it increased that patient autonomy through ownership of the information. Those are all great markers, leads to a better satisfaction. And look, if you increase knowledge of the disease, adherence, and self-efficacy, what are we saying? They're going to complete their care plans. They're not going to fall off your schedule. They're going to come to you as the expert because you are the one that shared the knowledge with them. All of those things grow your office and give the patient a better experience. So use the teach back method. It's a best practice. When we talk about 5 different ways to improve healthcare communication, straight from the evidence, here's one. Use the patient's preferred pathway of communication. What does that mean? It's 2023 as I'm shooting this. What's the preferred method of all the patients in your office? The answer is there's not a single preferred method anymore. You may be contacted through Facebook Messenger. Somebody may send a message to your business Instagram page, a DM, right? They may text your office. They may go to your website and hit your chat widget. They may call. They may email you. They may do a lot of things. They may find you on Google My Business and ask a few questions. What's really important is that you maintain their preferred method of communication. It promotes that they are in charge of their healthcare. So Kanisto, Kovivan, and Valamaki in 2014 in the Journal of Medical Internet Research found that SMS, so the use of texting improved the no-show rate, it improved adherence, and it had a positive effect everywhere. The interesting thing was the positive effect was much larger when the patients chose they want to use text messaging. If they didn't choose, that was not as effective. So what I took away from that is let the patient dictate how they want to communicate. And once they show you, continue to communicate until the patient shows you they want to do it a different way. So how do you do that? Well, with Trust-Driven Care, our software, there's a unified conversations platform where it doesn't matter if it's Google My Business, Instagram, chat widget, text messaging, and it all comes to the same place. And when you respond, it responds through that channel. Why is that so important? It helps the patient feel like they're in charge, which they are, of their healthcare journey. That autonomy, that buy-off improves their adherence, it lowers the no-show rate, and improves all markers of healthcare communication. So why wouldn't you use it? So let them dictate that process or that pathway and then use it. So with that, those are 5 ways you can improve healthcare communication through these best practices we find in the research. If you're looking for more information, check out trustdrivencare.com. Where our software is, it's where our education is. We're trying to make a difference in healthcare communication, but it starts with you. So if we can help, that'd be awesome. Let us know. See ya.